So continuing with factors contributing to obesity, sedentary lifestyle is another one. And again, having a historical perspective, being my age, I have seen how activity has changed throughout the years, over the decades. Aerobic exercise, not only burns calories, but it increases the basal energy expenditure for about up to a day after you perform exercise, especially vigorous aerobic activity. They call this EPOC, exercise post-oxygen consumption. Now, resistance exercise increases muscle mass, or maintains muscle mass at least, and muscle takes more energy to maintain than fat tissue does. So aerobic exercise also improves insulin sensitivity. So exercise is like medicine, for a lot of different reasons. Vigorous aerobic exercise also is an antidepressant. It lifts the mood. Now, again, my COVID lifestyle has been more sedentary. I like to go to the gym, the hospital gym right after work. So I can't do that right now because it's shut. So I'm trying to adapt and I haven't done really well because allergies are bad when I go outside to try and walk. So I have to figure out something. There are a lot of videos on YouTube now, exercise videos. Leslie Sanson does a walking video that we recommend to a lot of our patients. I know my manager does that one. So I have to figure out something to do with my lifestyle kind of being thrown with the current situation. But what I've noticed over the years, wasn't what I expected. What I've noticed over the years is that we don't need to move as much as we used to. We've made life really, really convenient. I remember the days when you had to get up to turn the TV channel. They have that joke. When I was a kid, I had to walk a mile to school in a foot of snow. Well, I had to walk 10 feet through shag carpet to change the channel when I was a kid of the TV. When I was a kid, everybody walked or rode their bikes to school, but a lot of times in this world, that's not as safe. We also have a lot of other convenience devices and more devices that occupy our time that require sitting rather than going out. I remember when there's only 3 TV channels plus PBS. Now we have Netflix that we can binge watch. So the exercise environment or activity environment has definitely changed. Another thing that contributes to obesity in some people is an increased fat cell number. Fat cells like to be a certain amount full. When they're emptied, they try to seek out energy to store to get to that certain level of fullness. So it makes sense the larger number of fat cells you have, because they like to be a certain amount full, the more difficult it will be to lose weight and keep that weight off. Because when you empty out the fat cell with weight loss, it will be more anxious to fill back up. So there's 2 terms, hypertrophic obesity and hyperplastic obesity. Hyper means high, trophic means size. So hypertrophic obesity is an increase in fat mass due to an increase in fat cell size. Hyperplastic obesity is an increase in body fat due to an increase in fat cell number. So the more fat cells you have, the more likely you are to be over fat. And when a fat cell becomes a certain amount full, when it becomes really big, it divides. So fat cell number increase through puberty. So childhood is a big time where you lay down a lot of fat cells. And this is why preventing childhood obesity will help prevent adult obesity. Obesity tends to track from childhood to adulthood. But you'll also increase in fat cell numbers during periods of rapid weight gain, because when a fat cell gets really big, it divides and you have more fat cell numbers. The glucostatic theory is basically that when blood sugar is low, the appetite control centers are stimulated to increase the appetite. So low blood sugar stimulates the appetite. If you've ever had low blood sugar, you'll notice this. If you go too long without eating, some of us get hangry, hungry, and angry. Some people develop dementia, hunger, and difficulty thinking. This is an issue for people with diabetes when they have a low blood sugar. We tell them to consume a controlled amount, 15 grams of sugar, but they're so hungry, sometimes it's hard to not go overboard to treat the low blood sugar, and then their blood sugar goes high, and it's an issue. One tip is, to help prevent the urge to overeat, maintain normal blood sugars by eating regularly. So now we're going to talk about, the next section, I'm going to end this here, even though this is short, because this is a new section.